Okay, so we referred a case for 3 wisdom teeth, as you can see on this image here, which is a 3D image that we took of the patient. On the top here, there's a wisdom tooth facing backwards. This is their bottom left, and that wisdom tooth is trapped underneath a little bit of bone. And if we toggle this orange structure here is actually a representation of the nerve canal. And if we just toggle that, you can see that the root has a curve on it and intimately related to that nerve canal, indicated by that dark area there. And on the other side, which is the patient's right side, you can see a similar thing, the nerve canal traversing and crossing intimately across the roots there. And if we just toggle that, you can see that in that area there. Now, this being a 3D X-ray, so this is a two-dimensional representation of a 3D image. And so if we look at it in a different plane, so if you now look at another plane, another orientation, you can see that on the 3D X-ray, this dark area here is where the nerve traverses across the roots of the tooth. And if we just toggle the nerve there, we can see that that's where that nerve is impinged upon and intimately related to the roots of that tooth there. And on the other side, you can see a similar situation. This is the part of the root of that wisdom tooth there, and this dark area is where the nerve is in intimate relationship with that. And if we toggle this, you can see that's identified there. Now on the full 3D image, you can see the upper wisdom tooth is here, and it is inclined backwards to a degree, but not too badly impacted. The lower left, patient's lower left, is impacted and trapped a little bit by a little bit of bone and leaning slightly backwards. And on the other side, you can see the patient's lower right wisdom tooth is inclined at an angle, trapped against the tooth in front, and a little bit more buried, a little bit more trapped under the bone. So we're going to have to surgically remove that and remove bone and get those out, being mindful of those nerves and things like that. Now, we have the situation these days, we have AI tools that can give us an even better indication as to how these nerves and roots are related, and we're just going to have a look at that. Okay, so here we can see the AI rendered image of the lower jaw, and let's turn that around and have a look more clearly. So you can see a degree of impaction, bit of trapping on the patient's lower left wisdom tooth there, and more clearly a more impacted lower right wisdom tooth lying at an angle. And if we peel away the bone and we reveal the nerve and its proximity, we can see in 3 dimensions how they're related. So on the patient's lower left, you can see the hooked root here very clearly, and the nerve compressed between the root and the outer part of the bone in that area there. So on the patient's lower right side, you can see that the nerve tracing disappears in intimate contact with the root there, and that's because it's so intimately involved and compressed against the bone that the AI has trouble recognizing and identifying where it actually traverses. But we get an idea that it does cross across there where that notch in the root occurs. So with this knowledge in mind, we can approach the surgery, understand what directions are important in regards to delivering force and things like that, to try and minimize the chance of risk of damage to these nerves, because damage to the nerve can result in alteration of the sensation in the lower lip and the skin below the lip down to the chin, so that vicinity there. Okay, so here you see the 3 wisdom teeth removed after surgery, and clearly the patient's lower left tooth with the hook on it, and this is the patient's lower right, and this is the upper wisdom tooth. Anyway, thanks for joining us. We'll see you next time as we continue to explore more complex dental procedures. Hi, and welcome to Modern Dental Solutions, where we handle complex and exceptional dentistry every day. See our other cases on our Facebook page. We take care of the entire process unless you are referred for a specific surgery or procedure. Remember, when choosing a dentist for complex work using social media, make sure that they can provide you with a diverse and abundance of examples of their work, as we do on our Facebook page. modern dental solutions for all your emergency and pain relief, root canal therapy, complex dentistry, extractions, dental implants, and bone grafting needs. All photos are taken by an iPhone or a Samsung phone or a small 12 megapixel handheld camera. Photos are not modified or enhanced except for cropping and labeling.